So what advice would you give a patient relative to the higher risk of post-transplant cancers?
So you got to remember, after a transplant, there are certain cancers that you are now at higher risk for. Skin cancers being number one, lymphomas being number two, but there's in fact a host of others that are slightly elevated above background. And then there are cancers that just occur in normal people, and deep down inside, a transplant person is a normal person. So these are all things that you should be aware of, that you're at risk for. And so the question is, what do you do about it? So routine cancer screening is important in the normal population as well as the transplant population, and the screening is a little different. So the mammograms, the colonoscopies, things like that that even normal people get, transplant patients should partake in all of these things. Skin cancer screening is very important since skin cancer is exceedingly common in a transplant patient. Going to see a dermatologist on a routine schedule, even if you have no issues, just for a skin check is probably a good idea. Being aware of your body and what's going on and keeping in touch with your transplant physician. So if there's something that you said, this is not right, so let's say a lymphoma that you can't even feel, just not feeling right, touching base with them and making sure that they stay on top of things and deal with whatever new issues crop up are important. And the most important reason for all of these things is many cancers caught early. Let's say skin cancer, you catch it early when it's a little dot, you buzz it, cauterize it, freeze it, whatnot, you're cured. Caught late, skin cancer is now major surgery or potentially metastatic disease and death. So there's a huge difference between a little dot and something now that has grown and has spread. So the treatments are different, easy versus not easy. The prognosis is different, 90% plus cure versus incurable. And so for all these things, prostate cancer, colon cancer, breast cancer, skin cancer, even lymphomas, it's critical that you catch it early because that'll affect your treatment and your prognosis.